All right, welcome back to a Wise Mind podcast hosted by Sabino Recovery through myself, Sam Zimmer. Today, we're very lucky to have Andrea Elkon with us. Andrea is a clinical psychologist based out of Atlanta, Georgia. She specializes in working with athletes and active adults who are struggling with the emotional and physical effects of injury and illness, as well as anxiety and performance issues and things of that nature. And she's actually developed a behavioral health program to offer a broader range of services to clients struggling with chronic pain and other conditions like that. So we're very happy to have you. Welcome, Andrea.
Thank you so much for having
Of
me.
course, of course. So one thing that we run into a lot here at Sabino, obviously, one of the main things we deal with is trauma, is chronic pain. And we were talking a little bit before we pressed record and how, pain can be a result of anxiety, and anxiety obviously can be a result of pain. So it's an interesting topic. So we're really glad to have you here and
Thank
kind of
you.
enlighten us on some of this stuff. So my first question is, how can pain bring on anxiety?
Sure. And if it's okay with you, I'll kind of talk back and forth between how pain can bring on anxiety, and then maybe we'll flip and talk about how anxiety brings on pain,
Perfect.
because they all sort of ultimately operate in this vicious
Right.
cycle. So, pain in and of itself, as we know, pain hurts. And it is our instinct that when we experience pain to do something to get away from it. The what we often talk about, the fight or flight
Mhm.
response. So in my house, there's a lot of Legos on the floor. When I step on a Lego, I move my foot away and maybe say a few cuss words. Um, so that's typically what happens, is that we try to get away from pain. But in the instance of something like chronic pain, you can't get away from it. So it's just constantly there, it's constantly agitating. And that in and of itself can generate tremendous anxiety and tremendous worry. And someone who's struggling with pain can start to worry about all kinds of things. You worry about, how long is this going to last? Is it going to get worse? How is this going to affect my ability to move, or to carry out, like, how am I going to go back to work? How am I going to pick up my kids? That we start to worry about how pain is going to affect all of those general life functions. And I think people worry about whether or not there's anything they can do to control it. So that in and of itself is knowing how much anxiety, how much pain, sorry, can I manage, can be incredibly anxiety provoking. Um, Not knowing when pain comes or doesn't come. So in the instance of chronic pain, it isn't usually the same sensation all of the time, but it waxes and wanes depending on activity level or mood or sleep. And so there can be anxiety around, when am I going to have a flare up? When is it not? And so there's just a tremendous amount of worry when you have this aggravating stimulus that you cannot escape from.
Right.
Um, so that is a whole constellation of pain bringing on anxiety. On the flip of that, we have anxiety that could bring on pain. Anxiety is one of those conditions that has a tremendous amount of physical symptoms. And so, for people who are not super excited to talk about their emotions, or maybe don't have the language to talk about their emotions, they do notice those physical symptoms. With anxiety, it can be muscle tightness, a tightness in your chest, shortness of breath, headaches, nausea, and with muscle tension, a lot of pain. So there's all different kinds of pains that are really manifestations of anxiety and the tension created by that kind of hyper arousal that comes with anxiety, that are talked about as pain symptoms, when in fact perhaps they are originally anxiety
Right.
symptoms.
And I was just thinking here, I mean, it would, for me at least, it would be much more, obviously being in pain is uncomfortable regardless of where it comes from. But I like your example. If I step on a Lego, I know where it's coming from, right? That's something where it's like
Exactly.
there's proof. Like I stepped on a Lego or I hurt my hand punching a wall or something like that.
Hmm.
I know where that pain's coming from. When it's the other way around, when I maybe have experienced some really intense trauma and I'm having symptoms of PTSD, one of which is this like somatic phantom pain, that can be
Mhm.
really confusing and disconcerting because it's like, what the heck is going on? So, I think you were starting to touch on that phantom somatic pain piece. Can you speak a little bit more like as to what that is and, how it affects somebody?
Absolutely, absolutely. And I want to start this with a caveat that all pain, any pain that is reported as a physical symptom, is real to that
Mhm.
person. So while there may not be a physiological cause, I think it is important as clinicians that we acknowledge that this person perceives him or her or their selves to be in genuine physical discomfort. And a lot of times there is a reason, like their muscles are so tense that, but anyway, so there is sort of like anxiety induced pain, but it does feel like physical pain to the client.
Right.
So anyway, all that to say, um, yeah. So as I was saying before, like sometimes we don't have the language, or we don't want to address. In the case of trauma, it is our brain's instinct to do anything to shut that out, to numb it, to closet it away, to push it somewhere. And so that is not something that folks typically want to confront. Um, their brains do not want to work through that. And so it gets tucked away, and then it starts to manifest in these other ways. Um, I think what you point out that's super interesting is that when someone feels really confused about why they're having that pain, that only increases the anxiety, which in turn increases the
I
pain.
was just about to say that
Um,
because, like, we've had people here before where it's like, their parents are supporting them and they have this pain and nobody can point to it on an MRI or any kind of like, medical
mhm,
scan or anything like that. And, parents, spouse, whoever that loved one is, they just don't understand it. They're like, I think this is all in your head. But like, as you said, that pain
mhm,
is so real to that person. And
mhm,
if your loved one is on the other side, just, I don't want to say not believing you, but, at least questioning like what's going on, I can only imagine
mhm.
how much more anxiety that would cause that person.
Absolutely, absolutely. In the same way that we never want to invalidate someone's emotions, being in a family that is invalidating that physical pain can feel really bad.
Right. Yeah, no, I think that's something that, and it's kind of like, the chicken or the egg, right? These two topics, did
Absolutely.
the pain cause the anxiety or did the anxiety cause the pain? Does it even really matter, right? Because the pain's there and it's something that needs to be dealt with. So, I'm really glad that we're talking about
Absolutely.
this. Um,
And the end result is that someone is left in this kind of chronic state of alarm. Our fight or flight mechanism is in the on switch, and that switch is not shutting off. So it's this chronic hyper arousal. And then there's all these secondary symptoms that come with that. Like when you're in that constant state, you don't sleep well. And when you don't sleep well, you get more
right.
anxious and you're in more pain. And your appetite gets thrown off, and that can create being in more pain. You
Right.
just kind of want to withdraw, and the lack of movement can create more anxiety and more pain. So it's, all of that.
So what does somebody do when they have that, the pain that's being caused by their anxiety, the more phantom somatic pain? Because actually, it's funny that we're doing this. 2 days ago, I pulled my hamstring playing basketball, forgot to do some stretching.
Hmm.
And, for me, it's really easy. I know what to do. I'm going to ice my leg. I'm going to elevate it. I'm going to, try to rest up as much as I can. Um,
Yeah.
but when it's something that isn't showing up and it's not as explainable, how does somebody who has that, that somatic phantom pain that's being caused by extreme anxiety, how do they treat said pain?
Hmm. So, we are all as clinicians on the mindfulness train now. Yes, that we love mindfulness, and I can't speak to it highly enough. A way to introduce that to clients who are experiencing pain is talking about how is your body communicating with us? What do you think your body is trying to tell you and trying to tell us about what's going on? And let's see if we can't tune into that. So we start to get folks to really be in the present, tuning into their bodily sensations. I'm sure at Sabino, you have therapists who are doing body scan meditations. That is a popular technique for getting clients to really understand their bodies more. They start to notice where the muscle tension is. And then when you notice that, you can start to intentionally release it. But all of these meditative, mindful exercises where we're tuning into deep diaphragmatic breathing, body awareness, noticing sensations instead of trying to push them away, which is what anxious and certainly people who have dealt with trauma try to do, is they try to push, push, push. So we're leaning into those sensations and being mindful about that. The more that we do that, what we're really doing is downregulating our nervous system. So that constant state of arousal that I was talking about before with pain and anxiety, the more that we tune into our bodies and become mindful and start to slow down, it reverses that arousal state. So we're really engaging the part of our nervous system, it's called the parasympathetic nervous system, that enables us to rest and calm. And the more we do that, that dramatically reduces a person's perception of pain and also perception of
Right.
anxiety.
One thing that I know people use to address pain is opiates,
Yes,
which I'm sure are very effective, at least in the short term, but obviously they come with a lot of drawbacks. And I was hoping maybe you could speak to that kind of in the scope of, obviously the opioid pandemic or epidemic that is going on.
absolutely. Absolutely. Yes, they are unfortunately effective, which is the problem in the short term, as you said. So the opioid crisis, or the origins of the opioid crisis, are pretty well known now. That there was a movement in after years backing up after years and years of knowing that morphine was highly addictive, and that maybe we shouldn't use it. There was a series of a couple of papers in the early 80s, I believe. And by papers, I mean like one was a paragraph and one was a page that said, we can't keep opioids away from our patients because they're so helpful. And Big Pharma jumped on those two paragraphs and created a marketing storm, with the release, Purdue in particular, with the release of oxycodone. And the marketing blitz was that oxycodone is not addictive. That we have, or Oxycontin, I should say, which is an extended release opioid, that because it's extended release, it is not addictive because it's just being slowly released. Of course, this was all nonsense. And unfortunately, there wasn't the pharmaceutical companies were strong enough in their marketing that doctors bought in. And so the going theory in pain medicine throughout the mid 90s through 2016 really was, let's just keep upping the dose. And so we had lots and lots of patients coming in for chronic pain. And the way that it was being treated was with opioid medication and more opioid medication and more opioid medication. Opioids, what they do is they sort of release a burst to the brain, that it creates this almost like a euphoria, where everything feels fine. You're not in any pain at all, emotional or physical. And so that burst does not persist past, so the data would say somewhere between a week and a month, maybe, yeah, a week and a month. And so people are wanting more and more and more, and doctors were giving it to them. The problem is that opioids stop working to treat chronic pain, like I said, within a week or a month. But what doesn't stop is that anti-anxiety piece of it. And so when people take opioids, I can't even tell you how many patients I've had who say, well, these aren't really helping my pain, but it makes me not care. And I think that's a really powerful statement, because it speaks to why it is so difficult to wean patients off of opioids. The emotional effect of them is incredibly powerful and incredibly hard to take away when people are so anxious about pain and don't feel like they have other strategies to manage that anxiety around pain,
Right.
or maybe even know that they are as fearful of pain as they are, that very focused on this is only a physical problem.
Right. And some people they get comfortable, like you said, with their taking opioids because it gets rid of their pain. It can kind of act as an anti-anxiety in some ways as well. So it's like, two for one, and that's really attractive to people. But there's
Absolutely.
also the people, like me, for example, who, have strong addictive tendencies. And I just
Hmm.
kind of a funny story is I've had two shoulder surgeries, and the first time I was in high school and I was just starting to get into smoking weed and drinking. And then along came Percocet that I was prescribed for my shoulder surgery. And,
Hmm.
I found out that I really like taking them and I like taking more than one at a time. And, one day I went over to the prescription bottle and I took about 10 of them and put them upstairs in my drawer. And thank God for my mom was checking the pills and she said, "Hey, Sam, noticed that there were some pills missing from your prescription. Know anything about that?" So she was thankfully on top of it and I didn't go down that road. Um, but I've heard countless stories of how, somebody who had never, you know, struggled with addiction until they had some big injury, playing sports or whatever the case may be. They busted up their knee and they
Hmm.
were prescribed oxys or Percocet, and that's kind of how the ball started rolling for them. So, I think the opioid epidemic is something we could probably talk about for hours, but I just wanted to highlight that, you
Absolutely.
know, it's definitely
Absolutely.
definitely a really it's dangerous territory when you get into that population that has those addictive tendencies for sure.
Absolutely. Absolutely. And opioids unto themselves, um, even independent of an addictive tendency, are so robust in their effect, excuse me, that it's hard not to become addicted.
Right. But they're so strong and they're so effective. So I get the draw, right? So I guess my next question is, obviously we know opioids are not the way to go, but for somebody that does have that level of like debilitating pain, we touched on mindfulness and some other things, but what else would you suggest for somebody who's in that much chronic pain? It's constant, it's debilitating. Is there anything else that they can turn to for some kind of relief?
100%. And best practices in pain medicine now speaks to the interdisciplinary uh, nature of treatment for chronic pain. Excuse me. So I think it's important, in addition to psychological strategies like mindfulness and deep breathing, that we also think about bringing in other integrative medicine, acupuncture, yoga, any kind of movement at all is excellent for chronic pain. We often work with chronic pain patients as part of it, like something that I do as a psychologist, is help to get my patients on a movement program, be that walking or yoga, swimming, some kind of gentle movement, which we know is really good for pain.
Yeah.
What happens is when people are in chronic pain, they get scared to move. And the less they move, the worse the pain gets, because we have muscle deconditioning, and just kind of being inactive can actually make you hurt worse. Um, so definitely incorporating those strategies. Um, I think that as far as medical strategies, sometimes interventional efforts, with injections and that kind of thing, can be helpful in certain circumstances. But in general, I think looking at just general wellness strategies that we probably use to treat clients not only struggling with chronic pain, but a variety of health and wellness conditions, that we're looking at exercise and sleep and nutrition, and psychological health.
Right. Yeah, that just reminded me, oftentimes the easiest thing to do, going the easier, softer way is not the right way to go. And depression, for
Yes.
example, um, the number one combatant of depression is exercise and getting your endorphins flowing.
Hmm.
But oftentimes when you're depressed, the last thing you want to do is get out of bed and go work out.
That's
same
exactly
thing with
right.
what you're talking about. If someone's in chronic pain, they have
Yes.
that fear over movement. It's just going to cause me more pain. But so they go the easier route and they, maybe take some opiates. I think it's
Hmm.
just important to highlight that, you know, often the hard route is the most effective route, and the short term solution obviously has the most drawbacks. So I think.
Absolutely. Absolutely. And we help our clients do this in small, measurable, achievable
Mhm.
goals so that whether it's a client struggling with depression, a client struggling with chronic pain, that when we start any kind of engagement in activity, we want to do it in slow steps. And this really empowers folks. As I said at the beginning, one of the things that people with pain get anxious about is an inability to control it or do anything to self manage. And by working through these kind of small movement goals, small meditation goals, and being able to actually do those, it really empowers folks to be like, hey, I have a handle on this, which then decreases the anxiety and it also decreases pain
Yeah.
perception.
And, perception. So like talk the perception that these kinds of things, work, like mindfulness and, being aware of what's going on in your body. I feel like it's not quite mainstream that these are effective
Hmm.
treatments. And correct me if I'm wrong,
Completely.
you're the expert, but like we had somebody, must have been a year ago, and he was considering coming to Sabino Recovery. He had struggled with intense lower back pain for a number of years, and before that, he's in great shape. He was a triathlete, and him and
Hmm.
his wife were just at a loss about this pain just came up out of nowhere seemingly, and they
Hmm.
called us because they had been to the Mayo Clinic. They had done stem cell injections. They had done just about everything you could possibly do to
Hmm.
address this back pain that this guy was having, except digging into his PTSD and his trauma from his childhood. And you know he himself was downplaying that part of it, right? Well, no, I had a great childhood. Everything was fine. And then, he was talking with our clinical director, Shara Turner, and the way she had just extracted it out of him that actually, no, your childhood wasn't that great. He started talking about how he was, severely bullied growing up by classmates, by his older siblings. And, it became very apparent that that was probably the stone that hadn't been unturned. But it's just
Hmm.
hard, and I understand, it's hard for people to grasp onto this concept of, mindfulness and, being aware of my body, and these things are going to be the ones that help me the most when I've tried, MRIs, stem cell injections, these things that, most people would think have more lasting results. So has that been a struggle for you in your field to kind of get people on board with trying something that they just don't think is going to work?
100,000%. So, and I can't say that strongly enough. And living in the United States, we continue to live in a medical model of illness, which means that if I have a problem, there's a pill, there's a surgery, there's a shot that will take it away, that will fix it. And I think that's promoted through, like, even when you see commercials on television, like, just take this pill and all your problems will be
Right.
gone. Or, and I think traditional physicians tend to promote that, like, I can fix it, I can fix your pain with this quick surgery. And so it is often feeling like an uphill battle. um, the model, again, that is, I think, has gained more widespread appeal. It's a matter of getting more widespread appeal in academic circles, I'll say. And the next step is to hopefully convey this to our clientele, is this biopsychosocial model of pain, which is that there's lots of things that make us hurt, not just physical factors. And when we get people to buy into the fact that maybe there are elements of your social situation or your social history that are making you hurt, maybe there are elements of your psychological well being that are contributing to why you hurt, like anxiety or sadness or trauma. That when we start to consider ourselves more holistically, and that there may be lots of things, not just medical causes, that are contributing to our pain, then clients are more willing. If they buy into that, then they'll buy into, okay, then it's not just a medical treatment,
Right.
that there's other things I can do and that I need to attend to my social wellness and my psychological wellness in addition to my physical wellness. And then maybe all of this will be feeling better.
Sure. What and a daunting task for a lot of people, right? It's,
Oh,
because,
definitely.
the example I used before, this guy tried X, Y, and Z. It's like, let's look for something that's going to fix me. But, hopefully it's just an injection, or hopefully it's just taking these pills. I don't think in a million years this guy thought he was going to have to dig into his childhood trauma and, the real source of everything. And that's something that not everyone is very, not very hot to do right off the bat.
Certainly not. Certainly not. Not if you've, consciously or unconsciously worked all your life to stomp that out.
Totally.
Like in the case of a triathlete, I'm sure that using that kind of intense exercise and that sort of focus is just a way of numbing out whatever trauma was going on, and a real safety behavior. And so, the back pain is saying, look, this old trick isn't going to work anymore.
Right. So the back pain, is that something that is common? I'm trying to get a feel for like some of the, the pain that's caused by anxiety. Is there anything that you see more than something else as far as like what's most common, as, as far as how that pain presents usually?
So, in terms of pain that is generated more, I would say, by psychological factors as opposed to physical factors, that I would say tends to be more of like a generalized discomfort,
Mhm.
like I hurt all over. I feel tense all the time, like kind of just constantly achy. Fatigue is often woven into that. I know we're not talking about fatigue specifically, but some combination of pain and exhaustion is something that I commonly see. Um, in terms of pain generated by anxiety, stomach complaints, headaches, uh, kind of like neck and shoulder discomfort, things that people do when they get anxious. Um, Folks will often complain about that. Back pain, again, like a lot of people hold tension in their low
Mm.
backs. Um, so it may be a variety of where we hold tension. TMJ, like people who grind their teeth or have a lot of jaw pain, that's another one. Um, we think about, if you just kind of look at yourself, like, where do I tend to tense up? And those are some of the typical
Gotcha.
spots.
Yeah. And I'm drawing a blank right now, but some of the folks that have come through Sabino, with that, I have pain all over, I don't know where it's coming from, they often have like one of like a few diagnoses that I feel like sometimes they're misdiagnosed. Are there any common diagnoses that, people with those kinds of symptoms get, but a lot of the times it's actually something else, like more along the lines of what we've been talking about? Does that make sense?
Absolutely, absolutely. So, are you talking about like clients or patients who come in with
Yep.
fibromyalgia
That's one of
diagnosis?
them. Yeah. Yeah.
Okay. Another one that same but different is something called CRPS, chronic regional pain
Mhm.
syndrome, where they're having like a burning sensation
Yep.
in one body part. Um, so those are illnesses, and fibromyalgia more so than CRPS. So that is a condition where it's basically the brain sensitivity to pain areas went into overdrive, and so everything, like, again, when I'm talking about that heightened state of alert or arousal, when you're in that chronic state, sometimes people get incredibly sensitive to even minor pain. The psychological, I guess what's analogous to this psychologically is something that we talk about as distress tolerance, that folks who even little things create these big giant emotional reactions. The analogy with pain is like even a little tiny thing creates this like incredibly dramatic reaction to
Like
pain.
stepping on a Lego,
Um,
you mean?
yeah, stepping on a Lego, but it's like that person will then feel like they're stepping on Legos
Right.
all the time.
Right.
Um, and so that again speaks to just the robust nature of doing things like down regulating your nervous system, tuning into what your body is doing, incorporating gentle movement. Like all of these strategies tend to be so effective for managing
Yeah.
pain.
And I imagine too, like, we've talked about the cycle that somebody can get into where their pain fuels their anxiety and vice versa. And then I would imagine too that that can lead to other things like depression. Is that something that you see a lot of?
Definitely. Years and years of being in chronic pain, years and years of being anxious gets exhausting. And so we will often see the fallout of that, as you may see with folks who come in with a trauma history. They have been living with the symptoms of trauma for so long that it's absolutely exhausting and they're just worn out and terribly
Yeah.
depressed. So absolutely. Yes.
And I know we touched briefly on like some of those body centered modalities like, massage, acupuncture. Are there any other treatments that you've seen to be really effective? Because those are two that we do here at Sabino. We also do Reiki, shiatsu, craniosacral massage, cupping,
Mhm.
and the list goes on. Is it really just anything that kind of has the potential to work in that way? Because we just like to expose people to as many things as we can, just to find out what works best for them.
Absolutely. I love all of those kind of body awareness, whether it's hands on, teaching people to self massage. I'm a big fan of the lacrosse ball. Like, I feel like everybody needs to have a lacrosse ball to learn how to self massage. But things like that, yes, I think those are all wonderful. And I think movement like flowy things like Tai Chi and Qigong, gentle yoga, all of those kinds of movement based strategies are also wonderful.
Yeah,
Um,
that lacrosse ball it is not soft. I can attest to that.
no,
I played lacrosse goalie one year. I got roped into it because they didn't have anyone try out for the team. My friends were like, "Hey, you want to come play goalie?" Not a fun position to have those lacrosse balls thrown at
yeah,
you at 80 miles per
yeah,
hour.
but they will work out a knot
Yeah,
in your
no, they will.
muscle.
You lean up against the
Nobody's
wall with the lacrosse ball, and those things can
Yep,
be.
it'll do it. And something I haven't mentioned, and I can't believe I've gotten this far in this discussion and haven't talked about all the thoughts that go with anxiety and go with
Yeah,
chronic pain, that there's a whole cognitive piece to this that seems to fuel folks' anxiety. Um, and I think that that is a super important part too. So I've talked a little bit about these thoughts around I have no control to do anything about this. Um, I haven't talked so much about pain magnification. So when people experience, somebody who's struggled with pain in the past or is currently struggling with chronic pain, any new pain input automatically becomes a big deal. So that people think that if for example, I have a patient right now who I'm working with, and she struggles with migraine headaches. Um, and she thinks anytime she gets even an inkling of like the smallest little head pain, oh my God, this is going to be another debilitating migraine, like really goes into worst case
mhm.
scenario mode. Very, very common for folks struggling with chronic pain and anxiety overlay is to go to worst case scenario, really magnify, make a catastrophe out of the problem. And so, one of the treatments that can be very effective is teaching clients to tap into those thought processes, those kind of unhelpful self talk that we tell ourselves when we're in pain or we're anxious, and helping them reframe okay, these are my unhelpful thoughts. What are some alternatives? And start to generate some more realistic ones. And that's work that they can do kind of when they're not in their most high pain states, but just when they're in a more regulated state, can start to really push on some of those unhelpful thoughts that come into their heads.
Yeah. No, and I think people talk about like the power of manifestation, right? And I'm not sure
Mm-hmm.
what the science behind that is, but I do believe into it, or I do believe it to some degree, where it's like if I have a positive outlook and that maybe this is a small headache that's going to go away, then it has a better chance of doing that. Again,
Oh,
I don't know the
yeah.
science behind that, but by the same token, like you're talking about, um, if you step on a Lego or you start to get a small headache and you start to catastrophize, I think your chances of that turning into a debilitating migraine probably increase. Yeah.
tremendously, tremendously by saying, by catching yourself saying, up, there I go. There's that unhelpful thought of me making a catastrophe. There's no catastrophe here. I'm safe. This is fine. This will pass. It absolutely reduces the intensity and duration of any
Yeah.
kind of pain
I
episode.
think one of the main themes of like our talk and what you've been able to enlighten us about is how simple these solutions are. You don't need to go get an MRI or a stem cell
Correct.
injection or something that drastic. A lot of it does start in your mind, and hope, and it can end there too if you just have the right tools and the right coaching to be able to kind of think through some of this stuff and realize what's happening in your body. And if you have the tools to kind of combat that there in the moment, then it can be a much smaller deal than it ends up being most of the time.
Absolutely, absolutely. And I think what's so important is part of this and why I mean, obviously I'm a psychologist, so I'm biased, but what I love about behavioral intervention is the level of empowerment that we give to our clients, that they then have the tools themselves. These aren't, I don't have to go to a doctor to get my prescription, or I don't, like I know how to do these things myself. And having that sense of empowerment and sense of confidence to handle these things is tremendously healing.
Yeah, you can. What's the saying? You can buy a man a fish and he'll eat for a day, or you could teach him to fish and he'll eat his whole life. Or by this analogy, they'll be
Absolutely.
pain free, hopefully, or at least know how to combat it on a more effective level.
Absolutely. That I think that the goal is always like, we're not sure that your pain is ever going to be 100% gone, but you're going to have all these tools to reduce the intensity and duration, and most importantly, be able to function in your everyday life and do all the things that you want to do and have meaningful relationships and continue to exercise. Anything you want to do, you'll be able to do.
Awesome. Well, and that's what we all want, anyways, right? We want to be self-sufficient.
Exactly.
We want to be self-sufficient. We don't want to be taking these drugs with all these negative side effects, and we just want to be healthy. And a lot of that, just like I said, I mean, how can you be healthy when you're taking opiates or doing injections all the
Right.
time with God knows what kind of side effects? So I think, your approach has
Absolutely.
been very enlightening, and I've definitely I've I've learned bits and pieces about this topic in my time in this field, but I can definitely say that I've learned a lot talking to you today. So thank you so much for joining us.
Absolutely. Sam, I really appreciate you having me.
Yeah, absolutely. And hopefully this podcast gets listened to by at least a few people that are struggling with these issues, and I'm sure that our conversation and your insight will really help them.
Oh, I hope so. I hope so. I hope people know there's help.
Well, thanks again for joining us. Really appreciate your time, and
Of
yeah,
course.
we'll talk soon.
All right. You have a great day.
Bye.